We got through the first 6 cranial nerves. Let's finish up the second 6. So the facial nerve. This is a mixed nerve again, both sensory and motor, all right? Has important functions for both. So taste information from the anterior 2/3 of the tongue. Once again, I'm going to recommend that you start grouping cranial nerves by function. We'll see that there are other cranial nerves that are also involved in taste. So here's your first one. Here's your first taste. And in some sense, it's kind of like the main taste because it's the anterior 2/3 of your tongue, which is most of your tongue. Motor portion innervates muscles of facial expression. So remember when we covered the muscles, you know what those muscles are. Buccinator, zygomaticus major, risorius, orbicularis oculi, orbicularis oris, and on and on and on and on. So guess what would happen if you had impairment of facial nerve number 7? You can be thinking already about how you would spot that. Facial nerve implicated in something called Bell's palsy, which when we do this in the classroom, I normally ask if anybody's ever heard of that. And we almost always have at least one person in the classroom who's actually had Bell's palsy, and several more who know somebody who's had Bell's palsy. So let's talk then about the 5 branches of the facial nerve: temporal, zygomatic, buccal, mandibular, and cervical, and you know all those words. So look in the lower right there, you can put your hand on the side of your face like that, and you can show which parts are innervated by that nerve, all right? So the temporal branch goes up into the forehead, and the zygomatic onto your cheekbone, and so on, all right? Facial nerve also has parasympathetic fibers that control the lacrimal glands, lacrima, so crying, and also sublingual and submandibular salivary glands. So look what else is going to happen with impairment of the facial nerve. Depending on exactly what happens, either you cry and you slobber all the time, or you can't do either one. So looking here at Bell's palsy, this is acute facial nerve paralysis. Can be caused by lots of things: viral infections, Lyme disease, misplaced dental anesthesia, so that guy who just got out of dental school sticks the needle in the wrong place, you go ow, and then you get Bell's palsy. But a lot of it is what they call idiopathic, which is a great word. If you don't already know that, this is wonderful. What does idiopathic mean? It basically means we don't know what the hell's going on. So, but it's a nice word to have, because when somebody goes to the doctor and they've got some kind of symptom, the doctor goes, you know, gosh, I just don't know, but I think it's probably idiopathic. Then they go home and they tell their friends, oh yeah, the doctor said it's idiopathic. Oh, idiopathic, just great. It's kind of the way doctors cover themselves, makes people think they've got an answer when in fact it's just a way of saying we don't know what the hell's going on. So usually resolves in like 3 weeks, can last 6 months or more. Typical Bell's palsy symptoms: facial asymmetry. So it often happens, it's unilateral or ipsilateral. So it only happens on one side. Damage to the nerve on one side, infection on one side, whatever. It doesn't happen on both sides. So one side of your face is responsive and the other side is not. Eyebrow droop, of course, because of corrugator supercilii and frontalis. Drooping of the mouth corner because of risorius, zygomaticus major. All right. Uncontrolled tearing. Remember, parasympathetic fibers to the lacrimal gland. Lips cannot be held tightly together, orbicularis oris. Difficulty keeping food in the mouth while chewing, so buccinator and orbicularis oris and so on. Those muscles actually help you manipulate your cheeks and lips and so on when you're chewing, and if you can't do that, it's kind of tragic and funny all at the same time. You try to chew food, these poor people with Bell's palsy, it's just falling out of their mouth. So look in the lower right, there you see a young woman. It's roughly the same age group as a lot of you. She looks very normal, doesn't she? And then, uh-oh, that's Bell's palsy. See, she's smiling actually. You can see on the left side of her face, but on the right side, those muscles ain't working. So always be careful, you know, when you see, I think there's a tendency, when people see somebody who looks like this, they go, oh, that person, yeah, they got some kind of mental condition. And you go up to them and you start like talking slowly and say, yeah, no, she might be a Nobel Prize winner in physics. She just has Bell's palsy, okay? I always, whenever I meet people who look odd in some way, I always start by assuming they're Nobel Prize winners and then working my way down. That's the better way to do it, I think. Some people you can work your way down in a hurry. So, and then there's another woman with Bell's palsy. Looks weird, doesn't it? Yeah, it's just basically, it's usually temporary again. It happens, not a big deal. Lots of people end up getting it. So which cranial nerve does not move the eyes? Alright, I'm encouraging you, group them this way, it'll help. That should be easy because you know that one of those is entirely sensory. Yes, cranial nerve number 2, the optic nerve, has no motor component of any kind whatsoever. Don't forget that. Alright, let's move on to number 8, vestibulocochlear. So there you can see, by the way, it's mixed, but it's mostly sensory. Alright, so again, almost all the cranial nerves are technically a little sensory or a little motor, but this is really a sensory nerve. So notice there, see on the right hand side, see that thing that looks like a snail? So there's the cochlea, and then notice the other part, the vestibule. Cochlea is where hearing takes place, vestibule is where balance takes place. So vestibulocochlear nerve. So what would impairment of vestibulocochlear nerve involve? Well, balance and hearing often, alright, see? Formerly called auditory or acoustic, but they changed the name to include the fact that it also has a big function in terms of balance. Vestibular carries impulses for equilibrium, that's the fancy name for balance. Cochlear for hearing. Notice it splits. See there in the right hand side of the diagram, vestibulocochlear has 2 branches, vestibular branch, cochlear branch. So again, each branch does just its own. And impairment of cochlear division can result in deafness. Impairment of vestibular result in dizziness, loss of balance, nausea, vomiting, and nystagmus, which is rapid involuntary eye movement. That's where people's eyes kind of like jiggle all the time. All right, so there you go. Look at the powerful diagnostic functions of the cranial nerves. Okay. Let's move on. Number 9, glossopharyngeal. Remember, root word glosso, tongue, pharyngeal, pharynx, throat. So this is a nerve of the tongue and throat. All right. It's a mixed nerve, very important mixed nerve, has important sensory and important motor functions. So let's take a look here. Sensory information from taste buds on the posterior third of the tongue. Do you remember now who else was involved in taste so far? Yeah, the facial nerve, number 7, was the anterior 2/3. So start grouping these together. Already we got 7 and 9 involved in taste. Sensory information from baroreceptors and chemoreceptors in the carotid body and sinus to the medulla oblongata. So, in your carotid artery, which is the big, giant, massive artery that takes all the blood from your heart up to your brain, you know, don't you think it's important to know if you're not getting enough blood to your brain? Yeah, it is important. And so you have baroreceptors. Baro, like a barometer, that's pressure, chemo, chemicals. So there are receptors in the carotid body, which is a kind of a wide part of the carotid artery, that are monitoring blood gases and blood pressure, all right? And if there's any problem, if you don't have sufficient blood pressure, or if your oxygen and carbon dioxide are off, mostly carbon dioxide, or actually I guess it's mostly oxygen. It's both, but yeah, then your brain needs to know that. So signals travel along the glossopharyngeal nerve to the medulla oblongata saying, hey, things ain't right, we're in trouble, you need to do something and fix it right now, or we're going to go unconscious, all right? So monitor CO2, O2, and blood pressure. And then continuing, has parasympathetic fibers that control the parotid salivary gland and innervate the stylopharyngeus muscle, which assist in swallowing, okay? So, again, saliva, do you remember who else had to do with saliva? Yeah, cranial nerve 7. Start grouping these, all right? And so swallowing, not surprising. There you see stylopharyngeus muscle involved. Why is swallowing a big deal? You might not think of that as a big deal, but it is. What would happen if you can't swallow correctly? Well, now you're going to be in trouble because food might not go into your esophagus and stomach. It might go down into your lungs, all right? So this is, swallowing is more of a survival thing than you think it is, all right? Fluids, if you're drinking water and it doesn't go down your esophagus, goes into your lungs instead, that's a big deal. So swallowing is a very important function. So impairment of glossopharyngeal, what happens? Loss of the gag reflex, loss of taste, difficulty in swallowing. Makes sense, okay? Moving on to the cranial nerve 10, the vagus nerve. Remember, vagus, root word vagabond, vagrant, all right? So vague. This is the wandering nerve, all right? It wanders all through the thorax and the abdomen. And it's very important. This is another mixed nerve with both important sensory and important motor functions. So let's pay attention here. So we saw that the glossopharyngeal, number 9, monitors the carotid body for blood going to your head. Well, what about the blood going to the rest of your body? Same thing. Very important to know if you're not getting enough blood pressure to your body, and so it's the vagus nerve that monitors that. The aorta is the largest artery in your body. It's that one big one that arches over the top of the heart. You can see it there in the illustration, the big red one that arches over the top of the heart. So if you don't have enough blood pressure, that's pretty serious. It means your organs are not going to get enough oxygen and glucose, and you're going to end up in big damn trouble. So, baroreceptors in the aorta monitor your blood pressure and send information again back to the medulla if things aren't going correctly. Also, taste buds on the epiglottis. Epiglottis we'll see in Bio 202. That's kind of like a big leaf-covered trap that covers your trachea. But you do have taste buds all the way down there. So can you remember now? We have 3 nerves now implicated in taste. Do you remember which ones they are? 7, 9, and 10. Group them that way. That'll help you. Also carries sensory information from visceral receptors in most internal organs of the thorax and abdomen. So we've talked before about visceral sensations, you know, a stomach ache, you know, knowing when you have to pee, all right, you know, pain from appendicitis or from gallstones or whatever. All of those signals are coming back, all right? That bloated feeling you get at that certain time of the month, you know what I'm talking about, ladies? So this is the vagus nerve. It's bringing all these sensory impulses back to your brain so you can have an idea of what's going on inside of your body. Pretty darn. And so then continuing, that was the sensory part, but motor, 75%, and you'll see different numbers. I've seen 85%, whatever. A lot of the motor impulses of the parasympathetic division to your lungs, your heart, and your various abdominal viscera are going through parasympathetic. So the signals that lower your heart rate, the signals that, you know, bronchoconstrict the lungs, these are all coming from the vagus nerve. So imagine impairment to the vagus nerve. This impairs your ability to control your internal organs, and that could be pretty darn serious. Other motor fibers innervate various muscles of the larynx and pharynx, also involved in swallowing. Do you remember now who else already did swallowing? Yeah, glossopharyngeal, number 9. Group the nerves by function. So 9 and 10 now also involved in swallowing. So what happens with impairment of the vagus nerve? Well, erratic heart rate and blood pressure, because remember, it's controlling those things and monitoring those things. Digestive dysfunction, difficulty swallowing, hoarseness of voice. So, yeah, impairment of vagus nerve is a big deal, all right? Spinal accessory, number 11. Again, this is the one that some people doubt whether it should be counted as a cranial nerve because it really originates on the spinal cord. It's mixed, but it's mostly motor. Let's think of it as being a motor nerve, all right? Unlike other cranial nerves, it originates primarily from the spinal cord. It comes up through foramen magnum and gets into the brain that way. It innervates neck and shoulder muscles like sternocleidomastoid and trapezius. So what do you suppose impairment of the spinal accessory nerve is going to involve? Yeah, elevating the shoulder, turning the head. So again, diagnostic function in the cranial nerve test, that's one of the things you're going to have people do, turn their head from side to side, raise and lower their head. You know, now there are lots of possible reasons that they wouldn't be able to do that. I mean, this is not a guaranteed diagnosis, but in other words, you put it together with other diagnostic information. It's a possible sign of impairment to cranial nerve 11 if people can't do those things, okay? And then 12, hypoglossal. Remember, hypo underneath, glosso, tongue. It's the nerve that goes under the tongue. Look there in the diagram. You can see right there. There it is, okay? So again, it's technically mixed, but I want you to think of it as a motor nerve, all right? Innervates muscles of the tongue used in speech and swallowing. So again, the tongue is a powerful manipulator of food in your mouth, all right? We see that especially in Bio 202 when we start looking at swallowing, deglutition, and so on. The tongue and the cheeks give you great control over chewing and swallowing. So this is pretty important in that respect. Impairment can result in difficulty in speaking and swallowing. Again, think of your tongue for speaking. Without a tongue, you really can't do much speaking at all. Your tongue is constantly touching your teeth, your palate, all kinds of places. That's how you produce different kinds of sounds. If you take a linguistics course, that's one of the ways they describe sounds. Apicoalveolar, the tip of the tongue on the roof of the mouth, and so on. Okay, which cranial nerve not involved in swallowing? All right, do you know it? This is the way to do it. Make flashcards. I would recommend you make flashcards. Have a flashcard like for swallowing, for taste, stuff like that, and then on the back side put the cranial nerve. So yeah, 11 is just movement of those neck muscles. Doesn't have anything to do with swallowing. Now, when we covered the bones, I made you learn certain openings of the bones, and I didn't make you learn certain other ones. And I already knew in advance that certain ones were going to be involved with the cranial nerves, and those are the openings I made you know. So I expect you to know the entry or exit for cranial nerves. So cranial nerve 1, remember that doesn't really, that's in the olfactory epithelium up at the top of your nostrils. Optic canal in the sphenoid bone, that was where cranial nerve 3 goes through, oculomotor. Cranial nerve 4 also, optic canals for 2, right? 3 and 4 are superior orbital fissure, along with the ophthalmic branch of 5, all right? All 3 of those go through the superior orbital fissure. Remember then on the sphenoid bone there was foramen spinosum, and there were other lacerum. I didn't make you learn those. I made you learn rotundum, and I made you learn ovale, because rotundum is where the maxillary branch of the trigeminal nerve goes, and ovale is where a mandibular branch. Notice number 6, again through superior orbital fissure. Look at that, 4 cranial nerves go through superior orbital fissure. 7 and 8 go through internal auditory meatus, all right? Remember that's facial and vestibulocochlear. 9 and 10 go through jugular foramen. 11 is the weird one. Remember, spinal accessory. It starts on the spinal cord, comes up through foramen magnum, and then continues through the jugular foramen. And then number 12 goes through the hypoglossal canal. So on your lab practicals, I'll have some bone that I will show you, and I'll mark an opening, and I'll ask you to tell me which cranial nerve comes through this opening. So start studying now.